Good morning.
Good morning.
Welcome back to Plastic Surgery 90210. I'm your host, Ariel.
And I'm Dr. Katzen.
And today we're doing part 2 of Plastic Surgery Myths Debunked by Dr. Katzen. Are you ready for this? And we are sponsored by our friends over at Fairgrounds. Thank you, Fairgrounds. I have a cold brew with half and half. What do you have?
Ooh, yummy. I have an Earl Grey double matcha latte, ceremonial matcha.
Oh my gosh.
With oat milk. It's
You're
the
going to be
yummiest
wired
thing ever.
again.
Yep. Still, this will keep me going till next week.
Oh, good, good. So last week we went over about 10 myths that are very common in plastic surgery. Like we talked about, will lipo always cause unevenness? We talked about, is general anesthesia really dangerous? And so today we're going to get more into that.
Okay.
You ready?
Let's do it.
All right. All right. First question of the day. Does plastic surgery freeze the aging process?
No, it doesn't freeze it. It may sort of set the clock back, but it doesn't sort of stop the aging process. It makes you look younger, and it just depends how young you want to look, I guess. And it's sort of a different look. But again, most of my patients want more of a natural look as opposed to I want to look like I'm 14 years old.
And I think it's important to remember that plastic surgery is all that external layer. It doesn't change, inside of you.
The internal core, correct, correct. But it can help you change the way you feel about yourself. So it's sort of, it really depends on the patient.
And if it changes the way you feel about yourself, it could also change the way you go about life. Maybe you'll exercise more, make healthier decisions. So that would all be a positive change.
Correct, correct. So sometimes we're doing procedures so patients can exercise more. Maybe they have an extremely large abdominal pannus, which is on their thighs, and they can't exercise, so we get rid of 20, 30 pounds. And then they can exercise.
Next question, does fat move to other body parts after liposuction?
No. So that's a very common question. So the question is basically when we're doing liposuction, say we're removing fat from the tummy and the hips, and then we remove it, does your body say, oh, there's an empty space around the tummy and the hips? Are we going to move fat from the back and the buttocks and fill in that empty space where the liposuction is performed? No. So with liposuction, we put in the cannula, we suck out that fat cell, we throw it away. And the body doesn't say, oh, we have an empty space over there, we're going to pile on the fat in that area. Or if you were to gain weight, but you're not going to gain weight after liposuction, if you were to gain weight after liposuction, it doesn't see that empty space and fill in that fat. So once we suck it out, it's gone.
And this is why I love neck liposuction. Jealous of every patient with neck lipo, by the way. Because we've had patients who have had neck lipo and they were like, oh, I gained 30 pounds. And I'm like, but your neck still looks so good.
Yeah.
Not that it's not fair, but I'm like, what? How is that possible?
Yeah, so, don't gain weight period. Okay, especially don't gain weight after plastic surgery procedures. But if you do gain weight, it's not going to go to those areas where we did liposuction.
Because the fat cells have been thrown away.
Exactly.
Yeah.
It's not like a sponge where we just squeeze the sponge and it's small and it could reabsorb. We take that sponge, we throw it in the trash. It's gone. It's not going to jump out of the canister and get back into your body.
So lucky. So lucky, neck lipo people. Petition to get Ariel neck lipo. Okay, anyway.
Yeah, I think she has a GoFundMe account. You can go check that out. I do.
Link in bio. Okay, next question. Are drains really as awful as people claim? A lot of times that's the biggest fear next to anesthesia.
Yeah, so I think it really depends on the patient, depends on the procedure, but usually drains are a part of the procedure. In my tummy tucks and body lifts and thigh lifts, we pretty much always use drains. On the arm lifts, we don't. Torsoplasties, we do. Back lifts, we do. Really depends on the patient and what is going on. But it's sort of part of the process. They're kind of annoying, but they are saving you and getting you the optimal results. So they're sort of the process. It's sort of like a bandage. You've got to do the bandage, you've got to do the garment, so you need the drains. We get them out not at a defined day number 13 or 14. The drain removal really depends on the amount of fluid that's coming out. If not much fluid is coming out, we take them out early. If a lot of fluid is coming out, we take them out later.
So drains are super important, and I wouldn't recommend going searching for a surgeon who does drainless tummy tucks or body lifts just so you don't have drains. But it does reduce seroma rates by about 30%.
30%, so that's huge. A seroma is basically a collection of serous fluids. Serous fluids, your body's super glue, which helps glue it back together. If you develop a seroma, oftentimes you've got to see your plastic surgeon every other day or every third day or every fourth day to stick a needle and drain it. So to avoid that, what most plastic surgeons use are drains.
And you'd be amazed to see how much fluid could come out of your body through those drains.
Absolutely.
You wouldn't want that to build up inside
Exactly.
you. Yeah. It's worth the extra couple of weeks with the drains than to not have it and to get poked every other day.
And the drain removal is not that bad. We have a lot of patients who just get all worked about the drain removal and they remove the drain and they're like, that's it? So they get all worried about it.
Yeah.
The drain is anchored with a little stitch. I cut the stitch and then we pull the drain out. Sometimes we can put local anesthetic around the drain, some numbing cream, maybe you'll take a Percocet, a narcotic before the drain removal, and sometimes even to the point where we use laughing gas or Pronox to have the patient relax for drain removal, but those are the exceptions.
Yeah, the drain removal is also very quick. You get it done in about 5 seconds.
Yeah.
So it's like just deal with those 5 seconds. I think if anything, people complain about like having to carry them around because they are attached to you in like a little fanny pack type thing.
Yeah.
But besides that, you know, they're for the better.
Yeah, they're doing you a favor. They're helping you heal.
They're for good.
They're for
Wicked
good.
for good.
Yeah.
Okay. If I have a raised scar, does that mean that the surgeon messed up?
Oh, good question. Not necessarily, okay? It really depends on what's going on, you know. Is it a high tension wound? Did the surgeon do that on purpose? Is it genetics? Is it a keloid? Is it a hypertrophic scar? Basically, if your scar line is raised, it could be the closure technique, okay? What we want to do is we want to avoid tension on that upper layer of the skin. And what we do to avoid that tension on the upper layer is we put the tension on the deeper layers. So if we put the tension all the way on the lower edges of the skin, then there's no tension on the upper layers.
Yeah.
So then that scar line's going to heal up nicely. So sometimes there'll be a bunched up scar for maybe about 3 or 4 weeks, and then that scar will flatten.
Okay.
So it really depends on the individual and the patient.
So like a raised scar kind of looks like if you were to run your hand around it, then there's like a speed bump,
Speed
right?
bump. Exactly.
Yeah.
Exactly. And then a keloid scar is a scar that outgrows the normal boundaries of the normal scar. So we use the speed bump analogy. You run your finger over the scar and you'll feel a little speed bump. If it was a keloid scar, it's more like a piece of cauliflower. So as you get close to the scar, there's a big bump, and then you approach the incision line, and then there's a big bump on the other side of it. So it's a much bigger scar than is normally expected.
Now your patients, even if they come in with keloids, you don't usually leave with keloids with your surgeries.
Correct.
So how does that work?
It's exceedingly rare that we get keloids in our practice. I think it's the way we do the surgery. I think it's the sutures we use. I think it's the compression that we use post-operatively for usually about 6 weeks. And then it's the silicone cream and silicone strips that we use later. So keloids in my practice, I would say probably maybe over the course of 25 years, I can only think of maybe about 3 or 4 patients, exceedingly rare.
Now, keloids and hypertrophic scars are genetic. Up to 15% of patients have biological predisposition, especially African, Latino, and Asian populations. Scar care matters more than the blame of the plastic surgeon, but also it does sound like it's technique as well.
Correct. So again, the majority is genetic. Okay, your plastic surgeon can only do what they can do to minimize the chances of keloids, but a lot of it can be genetic. Okay.
Will my belly button look weird after a tummy tuck? Common question.
Well, it depends on your definition of weird, okay? So a lot of patients are used to this sort of their sad face belly button after the weight gain and weight loss, so they're kind of used to that. So it's going to look different than the sad face because when we do belly button or umbilicoplasty during a tummy tuck or a body lift, we like to get more of a circular belly button. And there are different types of belly buttons. There are sort of the vertical belly buttons, they're the almond shaped, they're the round, they're the hooded, the unhooded, the male belly button, female belly button. So there's a whole chapter on belly buttons that we can talk about. But looking weird, it'll look different, it'll look better. It'll probably be in a better position after your tummy tuck.
How do you maintain a natural looking belly button after a tummy tuck or body lift?
So I think it's important for you and your plastic surgeon to sort of communicate what kind of belly button you want, okay? Some people want this kind of look of belly button. Bring in pictures to your plastic surgeon, email your plastic surgeon, I like this type of belly button. And most plastic surgeons can sort of create a belly button that you want, okay? Most of my patients just leave it up to me. They go, yep, I want a better looking belly button. And on women, like more of a vertical belly button that makes the waistline look thinner, maybe even an almond shaped or a pearl shaped belly button. On men want more of a circular belly button.
And I think it's important to know, you take their original belly button.
Yeah.
And you're just like relocating it, giving it a new zip code.
Correct, correct. So basically when I do a tummy tuck or a body lift, I make an incision around the belly button. I push the belly button in to maintain that blood supply, sort of like a little volcano inside. And then I pull the skin down and then pop the belly button out. The belly button didn't move, it's just that all the skin around it moved, and then we pop the belly button out.
Yeah,
Okay.
so really, that's your belly button.
Yeah.
If you think your belly button looks weird, you think your belly button looks weird.
So I mean, it's sort of like sheets on the bed in the morning. Okay, they're all messed up, and then as you tighten the sheets, it's the same sheet, but it's all just smoothed out. Same thing with the belly button.
All right. Last question. Is it true that plastic surgery is addictive?
Is addictive. Can be, okay? I call it sort of the neighborhood phenomenon. So basically a patient comes in, maybe they've lost a lot of weight or they're concerned about multiple body parts, and we do a body part. Say we do a tummy tuck or a body lift, and we get that area looking so good. Flat tummy, flat hips, pubic region, buttock lift, and they're like, wow, my tummy and hips and buttocks look so good, but now my thighs don't look so good. And then they go for their thigh lift, and then we get the thighs looking so good, then they're like, oh, what about my arms and my breasts?
Yeah.
So it can become addictive. So the neighborhood phenomena, the reason I mention that is, say somebody goes into a neighborhood, they buy a house, they tear it down, build a 3-story mega mansion, and then the house next door to it doesn't look so good because that mega mansion.
They're comparing.
Exactly.
Yeah.
So the proximity. So addictive, it can be. It really depends on, what your priorities are.
I do see that with your patients who come in for a tummy tuck. They get that tummy tuck, they're all snatched, and they're like, my breasts are, I can tell they're like way lower than they used to be because now my stomach's not distracting him.
Correct.
Yeah.
So it depends where sort of the eye goes and what your attention.
I wouldn't necessarily say plastic surgery is super addictive, but I do see that once you get something done, you're just more open to the idea of like getting more procedures done,
Correct.
which seems to be what happens. But at the same time, I wouldn't say it's addictive. I would say it's like just being open to it.
Yeah, I agree. I mean, there's certain patients that, you can get addicted to anything, even double plancha. So anyway, but you can get addicted to anything. Plastic surgery, you can get addicted. But usually in my practice, not, because usually the patients have multiple body parts that need to be addressed. So it's rare that we're doing the body lift for the 8th or 9th time.
Right.
Usually with the body lift, 99% of the time, first procedure done and that's it. Sometimes there'll be revisions of other plastic surgeons, but again, that's pretty rare.
Would you turn patients away if you felt like they had body dysmorphia and they were just coming in for too much?
Sure, absolutely.
Have you before?
Yeah, we have.
And I think that's like part of the ethical part of plastic surgery, huh?
Yeah. So it really depends, what the patient is looking for. Is it a realistic expectation? And then can we deliver on the plastic surgery procedure?
All right. Well, that's all the questions that we have. Great
Good.
job answering them.
Thank you. Thank you for your great questions.
Of course. Thank you so much. If you have any topics that you want us to cover in our future podcasts, please comment below. We'd love to hear them. We're always open to suggestions or questions. And we will see you next time.
Okay.
All right.
Have a good week. We'll see you next week.
We'll see you next week.
Cheers.
Bye.
Bye.